Hi, Deirdre Virvo here. Welcome to Let's Talk Seniors Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. I appreciate you coming here today to join us in this very interesting conversation we're going to be having with Joan Garbo. Joan Garbo, our guest, is a very special lady. She's a licensed clinical social worker, a certified case manager, and advanced professional member of the Aging Life Care Association. You might know them as geriatric care managers or senior consultants. She received her master's from Columbia U and has a bachelor in clinical psychology from Tufts. She has more than 25 years experience with social work, home care, acute care, family services, physical rehabilitation, combined with her ability to quickly assess and respond to critical situations. She's developed a unique and highly effective approach to aging life care management. She's recognized by healthcare professionals as an extremely knowledgeable and effective advocate for her clients. She's currently in practice in Fairfield County and living in Ridgefield, where it's very snowy today. So without further ado, we're going to welcome Miss Joan Garbo. Thanks so much for coming, Joan. Good to see you.
Thanks. Great to be here.
Yeah. So tell us a little bit about how you got into this field. It's so unique. Like before I was in senior care, I never even heard of aging care professionals.
Sure. My background is, like you mentioned, clinical social work, and I worked in healthcare for many years as a medical social worker and a hospital case manager. Mm-hmm. I also worked in home care, doing home visits for visiting nurse agency, and I worked in family services. And then I decided I really wanted to work one-on-one with the aging population and adults with disabilities. And so I left my job at that time, where I was a hospital case manager, and I started consulting individually with families and clients where there were challenges with aging or care or accessing the right resources or solving problems that they were having in their roles as caregiver for their family member.
Yeah.
In about 13 years, I've been in private practice now.
So how do people find out about you? How do people know? Like I've told so many people now about, so I also buy and flip houses, and I'll buy homes from people whose parents, need to go somewhere. And they have no idea that people like you exist. They're so thrilled to find out. I've been spreading the word, but how do people typically find out about you?
It's a lot of word of mouth. Other professionals who know me or know what an aging life care manager is. Now with, searching on the internet, you can find a care manager through my national organization, which is the Aging Life Care Association, or go on aginglifecare.org. And you can find a care manager across the country who's a member of my national organization. And you can read about what different people's backgrounds are. Sometimes we're social workers like me, nurses, people with degrees in gerontology. So there's a variety of backgrounds to be a private care manager like me. Mm-hmm. But you're right, we're a little bit of a well-kept secret as a consultant to help families struggling with aging issues. And I sometimes say, you can't just Google, how do I take care of my mother? Or how do I take care of my father? And get, anywhere with that. That's honestly very helpful. So you really need a professional to help you, often with complex issues.
So give us some of the ideas, give us the gamut of what you do.
So like I said, I really am a problem solver. A care manager assesses a client, looks at their home environment, looks very holistically at their medical issues, how they're functioning, their support system, what the challenges are. And then we try to take that apart and solve what those problems are through community resources, other organizations, or services that people might need. It might be home care. They might need to be ready to start a companion or a caregiver in the home. They might be thinking about moving because the home is not working out or care is not working out in the home. And they need to understand what the options are and what's the right fit in terms of moving to a different community setting from the home. It could be a financial issue of how to pay for care and understanding programs that are available. It could be family dynamics that are getting in the way of care. And that's where somebody with a social work background like me can really help. So every client is different, I say. So, it's really about just getting in there and figuring out what to do to make this situation better.
Well, that's a godsend. So you're going to give us some tips, 5 things to know about your aging parents. So
right, 5 things to know to, I would say, help your aging parents was kind of what I was thinking about today. What's some really good things that are important that I find people don't do, and then they have a crisis sometimes. So number 1 is know the medical issues that your parents are having. I can't tell you how many times I start with families that either they don't live locally or they haven't been that involved, and then all of a sudden they need to do something or realize they need to do something, and they don't know who are the doctors. So find out what doctors you're seeing. Find out what medications your parents are taking. The dosages and the names, and look at the bottles to find out. If you can't find that, go to the pharmacy and ask for a printout of what the medicines are.
Will they give that to just anybody?
No, you have to have a power of attorney or a healthcare representative, or go with your parents if they're able, and they will give consent for that, because that is protected medical healthcare information. So you want to know the medical conditions, diagnoses, doctors, and then type that up and make yourself a nice list so you have it ready in case of an emergency, and then update it. So that's number 1, is learn the medical situation that your parents are dealing with. Number 2 is financial. So you want to start to know about your parents' finances, because there will come a point where something will happen and they might start to need care, or there could be an emergency and you need to do things quickly, and you need to understand what they can afford and what sources of funding they're going to have for their care. Some people are going to rely on their savings and their income. Some people are going to be able to tap into long-term care insurance if they have long-term care insurance. And sometimes discovering a long-term care insurance is like a big pot of gold, I say, that you can tap into that you might not have even known your parents have, and you need to learn about how to activate a policy and what it covers and all of that. So learning about the finances is really important, and trying to have a heart-to-heart with your parents if they're very private and don't want to tell you this information. Start to say, look, if there's an emergency, I'm going to need to know this, at least have it written somewhere where I know I can access it. Things like banking and passwords are complex and impossible information to get if you don't have the right access ahead of time, like a power of attorney document. And so that leads me to number 3, which is legal. Legal information. Are the legal documents done that people should have? And those are 3 things. Power of attorney, so that you can access banking, you can pay bills if your parent is incapacitated or hospitalized, or has a progressive neurologic condition or cognitive decline. You might need to step in, and you want to make sure you have a properly executed power of attorney. You want to make sure that they have a healthcare representative if there is a medical emergency and someone needs to make some decisions. Or again, if there's a cognitive issue and things are changing and you need to make some healthcare decisions, you need to have that document. And the third is a living will for your end of life wishes in case you were in the situation of needing feeding tube, breathing tube. That's a very specific situation. It's just important that you have that document. So those are the 3 important documents to have when you're alive, I say. Your will is number 4 and very important, but that all comes into play after you die, and that's what happens to your assets. And I always say, I just am more concerned with what happens while you're still with us, so that your adult children or somebody else that you trust is in those roles and you've done your documents.
So one thing that my lawyer just recently told me is that the POA should be updated every 6 months to a year. Because you might think you have a POA, but
That's surprising. I've heard every 3 to 5 years.
Well, it can
6
be
months.
it can be contested easily. But yes, if it's older than 3 to 5 years, it almost doesn't stand up. But they say that the more current it is, the better it will stand up. Because anybody else can come and say, oh, that was an old one he did. And, he already said he didn't want that. Or, something like that. So that really should be kept up. It's not like a once and done. That's what they say anyway. So if you did this with your parents 15 years ago, this has to be updated.
Well, if it's more than 3 to 5 years old, then it should be updated for sure. Okay, and then number 4 is a discussion about housing and what your parents or family members' wishes are as they're aging in place, staying in their own home, or are they thinking they want to move at some point? Because often I see this discussion comes really very late in the aging process. And sometimes it's too late to move to a community that people want to move to or think they have to move to at that point. They're already having a lot of medical issues or complex care needs, and maybe don't even qualify for an assisted living kind of setting. And it's important to start having that discussion early. And I think especially people who are in denial about aging, which a lot of older folks are, they think they're just fine until they're not. But there's a lot of planning that goes into, is aging in place your goal, making the home accessible and safe, or looking for the right place that is, because let's say your home isn't accessible or safe and not suitable for aging in place. You don't want to wait until you can't walk up and down the stairs to realize that you have to move. So be proactive.
So true. Joan, but I feel like this is a very evolving one, because I know just from my own relatives, they had one thing in mind, like maybe age in place. But like for my mom, she's only 83 and she's healthy, but my father passed and so many of her friends have passed. So now she's lonely. So where she might have wanted to age in place because she had neighbors and friends still living near her, now she wants to come to Connecticut near my brother and I, which I'm so happy about. But I think that's like an evolving thing. If they're fine, if they're driving, if they're not driving, different situation. If they start to get sick, they lose a spouse,
Yeah.
So this is kind of an evolving thing, don't you think?
It is, but starting the conversation and planting the seeds and ideas and looking at options early is what I recommend people do. But yes, things do change. And then something that was out of the question before is now all of a sudden the best solution. So I think talking about it is the most important thing, that you open the conversation.
Yeah, I think this is a tough one. Like my mom's only been open to this in her 80s. She was not open any time before that. But I love the advice that you gave, because I'm thinking like even my in-laws, they don't want to talk about wills or anything, but telling them to write their list of medicine, write everything where it's accessible. They don't have to share it at the moment. but having it all accessible is imperative. Like, you don't have to tell us, but just make sure you have it all down. But we do need everybody's POA, health directive. I just did that for myself recently, because you can never do that too soon. So that
right. And even if there's resistance about sharing finances, I would just ask them to inventory all of their accounts and make a list for you, and then put it away somewhere and just let you know where that is for when the time comes. And who is your lawyer and who is your accountant? Important people that might need to be called upon. If you can't give that information yourself, it's important for you to know where that is. So that's housing was number 4, and then I was trying to come up with like a top 5 list.
You're like the David Letterman of seniors. Top 5 lists are.
I can make the list really long or short. So number 5 I thought is quality of life. Look at what is the quality of life that's going on now. COVID has ruined quality of life,
especially for seniors. Especially for seniors.
So let's say pre-COVID, you'd want to know what are your social activities, what are your stimulating activities, how much exercise are you getting, what are you doing for all of those things, and trying to encourage and find ways to access those activities. With COVID, that's been really ruined and been very difficult, especially for older people that just can't Zoom all day, or don't have internet, or didn't even have a computer, or, really challenging stuff going on for older folks. So
it's a tough time.
We're doing the best we can, but looking at quality of life, I think, is the other thing to do. And, not be critical of your parents if they're not doing so great in those areas. Sometimes I get adult children who are like, they don't exercise, they need to exercise more, they don't do this and they don't do that. And we know what's good for older people, and we know what's good for us, but we can't force older folks to do stuff that they don't want to do. We can just keep encouraging and try to make it easier for them.
Sure. All great advice. And can I just tell you something funny? I actually wrote an entire workbook on everything you just said. I have a book, Home to Home, and a workbook. And it's super duper. It's all about exactly what you just said, sitting down with your senior and planning, where's the money, where are the accounts, what would you like to do, here are the different kind of housing options, stay in your house, call people in, where's the money, who's your, gathering everything, actually gathering statements, bank statements, accounts, and just keeping them all in a book.
Make a notebook with all this information.
I actually wrote an entire workbook to do workshops starting March, and I went to one senior center in Fairfield, and then COVID hit. So, if you have clients that want the workbook, I will send some to you, Joan, because it's just exactly all the information you just gave, which is
definitely, because that's, people do ask me for that kind of resource sometimes is, what do I don't know what I don't know, and tell me what I need to do to be prepared and help people. And so this is the basics of what that involves. And then putting it together will take time. You can't do this all in one sitting.
And you can never be too young to do this, because I'm doing it for myself as well. And it doesn't have to be that, you think you're going to die, just anything can happen. So, you don't want to leave things to last minute and not have anybody, the worst thing is I know people have passed away and left kind of a huge mess to their family because nothing was organized. And that's the worst thing, because you want to be grieving and feel bad for you. And
I see that too. And that's why I really encourage all of these things ahead of time. And even, there's one thing I left out with part of medical that's really important is insurance. Your medical insurance and your insurance cards, and take photos. Get your parents to take out their wallet, take out their Medicare card and their supplement card and their prescription card, and take photos of front and backs of those cards, because they can go missing and then it's a hunting expedition to find them. And then we know that every time we go to a doctor, those of us that have been to doctors lately, the first thing they want to see is the insurance cards all the time. It's not just like a once a year thing anymore. They always want to see it for some reason. It's, they want to make sure it hasn't changed and all of that. So
good advice.
Get copies of those and then, take photos, print it out, keep hard copies too.
All great advice, Joan. A little upfront planning will save a lot of time on the back end, and your wishes will be known, especially like what you want to do with your money, where you want to live, and where you want to eventually go. You want to plan that out before your kids plan it for you.
Absolutely. You got to make your wishes known and make sure people are appointed that you trust who are going to carry that out for you. But you have to have the conversation. You can't just create your legal documents and tuck them away and never tell anybody what you really wanted. You have to tell people.
Yeah, so true. Thank you so much, Joan. So if people want to get in touch with you, they can give you a call at 203-894-1155. I guess you deal with a lot of people with out-of-state children whose parents are in Connecticut and they're not sure what to do with them. Would that be fair?
Yes, very often, but also a fair amount who are local, who just, people are busy with their own lives. They have jobs and their own kids, and taking care of elderly parents can become a full-time job. And so often they need a partner, a professional to help manage that process.
And to decipher what it is they should be doing. It's confusing.
Right.
There's a lot to know.
Independent professional advice, so without the emotions involved, is a lot of times what I'm doing. And often I'm saying some of the same things their children have told them, or have suggested. They won't listen to their adult children, but they will listen to me sometimes. So
I can tell you're very
works, right?
I can tell you're very calm and very persuasive, and you have a way about you that, makes people believe what you're saying and listen to you, and you have all the skills and profession behind you. So, Joan, thank you so much. I think I told you at the beginning, and I'll tell you again, I was told you are the go-to person on geriatric care in Fairfield. So I'm so glad to have met you.
Well, thank you so much. I'd be happy to be here again to talk about some other topics.
Sounds great. Thanks so much for your time.
Okay. All right. Bye-bye.
Bye. That was Joan Garvo. She is a wealth of information. This is really an interesting topic because my mother-in-law, for instance, is right now in the hospital, and you pretty much need an advocate. And it's really hard to even decipher what to do when somebody's in the hospital, nursing homes, after that rehab. It's almost a full-time job for the kids to figure it out. And what to do after that there's so much you can do, and there's money. There's places you can get money that people don't even know about. So that's what you need Joan for. So feel free to call upon her, and she will be happy to answer all of your questions. Till next time.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else, Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.